Welcome back, everyone. Ready for another deep dive?
Always.
Today, we're tackling diabetic nephropathy.
Ooh, yeah, that's a big one. Lots to unpack there.
We've got a whole pile of medical journals and articles here.
Trying to make sense of it all for you.
Exactly. So, cutting through all that jargon and...
Giving you the need to know.
Absolutely. So, first things first, what exactly is diabetic nephropathy?
Well, in a nutshell, it's basically kidney damage
Okay, but kidney damage from what?
from diabetes. Specifically, high blood sugar over time. You see those tiny filters in your kidneys?
They clean your blood, right?
Yeah, exactly. So when they get damaged, well, it's a problem.
Big problem.
Big problem. It can actually, if it goes on long enough, lead to kidney failure.
So this isn't just like, oh, I have diabetes, now my foot hurts.
Oh, no, this is serious stuff.
Serious stuff. That's why we're doing a deep dive on it.
That's why everyone listening who has diabetes should pay attention.
Especially pay attention.
Yeah. But there is some good news here. Oh, tell me good news.
Usually this diabetic nephropathy develops slowly.
So it's not like, boom, overnight your kidneys are shot.
No. That means it can often be caught early.
And early detection has got to make a difference.
Huge difference. That's why those routine checkups are so important.
So it's like catching it before it really gets bad.
Precisely.
Yeah.
Now, these checkups, they involve a few key tests.
Let's hear them. What are doctors looking for?
The first one's called the urinary albumin test. Now, albumin, it's a kind of protein.
Okay, protein.
And it's not supposed to be hanging out in your pee.
Right.
So if it is showing up there, that's a sign,
A sign that something's leaky.
Exactly. Leaky filters in the kidneys.
Mm-hmm.
Not good.
If they see albumin, that's like, uh-oh, time to investigate further.
Yeah. Then they also do this thing called the albumin to creatinine ratio.
Albumin again? So what's creatinine?
It's another substance they measure in your urine. This ratio, it tells them how much protein is leaking.
Oh, I see. So it's not just, is there albumin, but how bad is it?
You got it. Like, how stressed are those filters?
Okay, so 2 tests down. What's the third one they use?
The glomerular filtration rate, or GFR for short.
GFR. Catchy. What's that all about?
It measures how quickly your blood is getting filtered.
So, like, how efficiently the kidneys are working overall.
Exactly. A low GFR, that's a sign things are slowing down. Which
could mean diabetic nephropathy.
Yep. Now, sometimes those 3 tests aren't enough.
So what else do they do? Stick a camera in there?
Sometimes they might use imaging, like ultrasounds or MRIs.
To get a good look at the kidneys.
Yeah, to see what's going on in there. And in some cases, they might even do a biopsy.
Biopsy. That sounds serious.
It is. But it gives them the most detailed picture of the kidneys.
So let's say, worst case scenario, the tests show diabetic nephropathy. What happens next? What's the treatment plan?
The most important thing, the very first step, is tackling the root cause.
You mean the diabetes itself?
And any high blood pressure, too. We're talking diet, exercise, meds.
The whole shebang.
The whole shebang. It's all about preventing that damage from getting worse.
It's like we always hear, lifestyle is key. But it sounds like, especially with this.
Yeah. But lifestyle changes alone, they might not be enough.
So medications come into play, too.
Absolutely.
Yeah.
There are specific meds that can really help manage diabetic nephropathy.
Okay, I'm all ears. What are we talking about here?
Well, there are these things called ACE inhibitors and ARBs.
ACE inhibitors, ARBs. Okay, I'm writing this down. What do those do?
They help control your blood pressure, which takes some of the strain off your kidneys.
So easing the pressure, helping them work better?
Exactly. And of course, you've got the usual suspects for blood sugar control.
Right. Got to keep that glucose in check.
Yep. But there was one type of medication that really surprised me.
Oh, what was that?
Statins. Now, we usually think of statins for lowering cholesterol, right?
Right. Heart health.
Exactly. But they've also been shown to, get this, reduce protein in the urine.
Whoa. So they're multitaskers.
They are. Protecting your heart and your kidneys. Pretty cool, huh?
That is pretty cool. What else is in the medication toolkit? Anything else stand out to you?
Well, there's this newer medication called finerenone. It's pretty interesting. It specifically targets scarring in the kidneys.
Scarring?
Yeah, you see, when the kidneys get damaged, they can develop scar tissue, and that makes things worse. This finerenone, it tries to prevent that.
So it's like not just managing the symptoms, but actually stopping the damage from progressing.
Exactly.
Yeah.
And then there's this other class of drugs that's getting a lot of attention, SGLT2 inhibitors and GLP-1 receptor agonists.
Those are mouthfuls. What are they all about?
They do more than just control blood sugar. They've actually been shown to protect both the heart and the kidneys. Double whammy.
Sounds like a win-win.
It really is.
So it seems like with the medications, we're moving towards a more holistic approach, I guess, recognizing that everything's connected.
You're absolutely right. It's all connected.
But what if, despite all these efforts, the diabetic nephropathy keeps getting worse?
That's when we start talking about more serious interventions. There are three main paths at that point.
Okay, lay it on me. Path number 1.
Dialysis. It's essentially a way to artificially filter your blood when your kidneys can't do it themselves.
Wow. So like an external cleaning brew for your blood?
You got it. There are two main types. Hemodialysis, which uses a machine, and peritoneal dialysis, which uses the lining of your abdomen.
So one's like going to a clinic and the other is more at home.
Right. Hemodialysis usually means going to a center a few times a week. Peritoneal, you can often do it at home.
I imagine they both have their pros and cons.
They do. The best option really depends on the person, their lifestyle and their health.
Big decision.
Big decision, yeah. Now, the second path is a kidney transplant.
Ah, so that's getting a whole new kidney.
Exactly. A chance to, get back to normal kidney function.
That's got to be the most hopeful option, right? To be free of dialysis and just have a healthy kidney again.
It is. But it's not a simple process. There's a lot of testing and evaluation to make sure someone's a good candidate for a transplant.
So not everyone qualifies.
Right. And sometimes, for people with type 1 diabetes, they might even consider a combined kidney-pancreas transplant.
Wow. 2 transplants at once.
It's pretty amazing what they can do these days. And then the third path is what we call supportive care.
Supportive care. So what's that? Like pain management and stuff?
It's more than that. It's really focused on, comfort and quality of life for people who decide not to go the dialysis or transplant route.
I imagine that's a really tough decision to make.
It is. It's a very personal decision, and it highlights how important it is to have open conversations with your doctor.
And with your family too, I bet.
Absolutely. It's about making the best choices for you. Now, I know this all sounds a bit heavy.
It is heavy. But we did hint at some exciting possibilities for the future. What about those? What's on the horizon for diabetic nephropathy treatment?
Well, regenerative medicine is really making waves. It's
Right.
pretty amazing, actually.
Regenerative medicine. Okay, remind me, what's that all about again?
It's all about helping your body, repair itself. Not just managing the damage, but actually fixing it.
So like instead of just putting a Band-Aid on the problem, we're talking about actually healing the wound.
Exactly. And when it comes to diabetic nephropathy, one of the most exciting areas is stem cell therapy.
Stem cells, those are the miracle cells, right? The ones that can turn into any kind of cell.
That's right. They have the potential to become, well, anything, including kidney cells.
So they could be used to patch up those damaged filters in the kidneys.
That's the idea. Researchers are working on ways to deliver stem cells directly to the kidneys so they can get to work repairing the damage. It's pretty cutting-edge stuff.
That's incredible. So while we wait for these futuristic treatments to become a reality, there's a lot we can do right now through lifestyle changes. We've talked about the importance of managing blood sugar and blood pressure, but are there any specific diet recommendations for people with diabetic nephropathy?
Oh, absolutely. Diet plays a huge role in managing this condition. And it's not just about what you eat, but also how much. Portion control is key.
So even if you're eating all the right things, overdoing it can still put a strain on your kidneys.
Exactly. And beyond portion control, a diet that's lower in sodium, potassium, and phosphorus is generally recommended.
Now, why are those 3 minerals a concern for someone with diabetic nephropathy?
Well, when the kidneys aren't functioning at 100%, they can have trouble filtering out these minerals effectively. This can lead to a buildup in the blood, which can cause a whole cascade of problems.
Okay, so it's all about keeping those mineral levels in check. What are some practical tips for doing that?
For sodium, it's all about reading those labels. Look for low sodium options and try to avoid processed foods, which are usually loaded with sodium.
So cooking at home where you have more control over the ingredients is a good strategy.
Absolutely. Now, potassium can be a bit trickier because it's naturally found in a lot of healthy foods like fruits and vegetables.
And those are the things we want people to eat more of.
I know, right? It's all about finding that balance. Working with a registered dietitian can be really helpful here. They can create a personalized meal plan that considers your individual needs and restrictions.
So it's not about cutting out fruits and veggies altogether, but finding that sweet spot where you're getting the nutrients you need without overloading your system.
And what about phosphorus? What foods should people be mindful of there?
Dairy products, red meat, and, you guessed it, Those processed foods, again, tend to be higher in phosphorus.
It sounds like a good rule of thumb is to focus on whole, unprocessed foods as much as possible.
You got it. The more you can cook from scratch, the better you'll be able to manage your intake of sodium, potassium, and phosphorus.
This is a lot of information. It really highlights the importance of having a registered dietitian as part of your healthcare team, someone who can really guide you through all this. Now, what about alcohol? Is that something people with diabetic nephropathy need to be careful about?
Absolutely. Alcohol can really stress those kidneys, especially when they're already working overtime. So cutting back or even eliminating alcohol altogether is probably a good idea.
Exactly. It's always best to play it safe when it comes to your kidney health. We've been talking a lot about the physical side of managing diabetic nephropathy, but it's important to acknowledge the emotional and psychological impact, too. It's a lot to deal with.
Absolutely. It can be overwhelming to navigate all the lifestyle changes and just the emotional weight of a chronic illness.
It really can. And that's why I think it's so important to seek support from mental health professionals. Therapists, counselors, they can give you tools and strategies to cope with the stress and anxiety that often come with a diagnosis like this.
It's a good reminder that taking care of your mental health is just as important as taking care of your physical health. They go hand in hand.
I couldn't agree more. It's all connected. And even beyond professional help, there are things you can do on your own to manage stress and improve your mood. Things like mindfulness exercises, spending time outdoors, connecting with loved ones.
Finding those little pockets of joy in your day.
Exactly. And let's not forget the power of community. Connecting with other people who understand what you're going through can be so valuable.
It's about knowing you're not alone in this. And speaking of support, we mentioned the American Association of Kidney Patients and the National Kidney Foundation earlier. Are there any other organizations that people with diabetic nephropathy might find helpful?
The National Kidney Foundation has a fantastic helpline that people can call for information and support. It's a great resource.
So direct access to experts who can answer your questions and provide guidance.
Exactly. And of course, there are lots of helpful resources online too. The American Diabetes Association website has a wealth of information on diabetic nephropathy, from managing the condition to recipes and support groups.
It's amazing how much information is available at our fingertips these days. But it's also important to make sure you're getting your information from credible sources.
Absolutely. Don't believe everything you read on the internet. Stick to reputable organizations and always talk to your doctor before making any big changes to your treatment plan. They're your best guide.
Speaking of personalized guidance, you mentioned regenerative medicine earlier, and it sounds incredibly promising. But I have to admit, I'm still a bit fuzzy on what it actually is.
So regenerative medicine is this really exciting field that's focused on repairing or replacing damaged tissues and organs.
So instead of just managing the symptoms, regenerative medicine is about actually reversing the damage.
That's the goal. It's about harnessing the body's own incredible ability to heal itself.
That's mind-blowing. What are some of the regenerative medicine approaches being explored for diabetic nephropathy?
Well, stem cell therapy, which we talked about earlier, is one really promising avenue. Another is bioengineering, which is like next level stuff.
Okay, bioengineering. Now that sounds futuristic. What does that involve?
Bioengineering is basically creating artificial tissues or even entire organs in a lab, like building a new kidney from scratch.
Oh, that sounds like science fiction.
I know, right? It's incredible to think of the possibilities. Imagine a future where we can just grow new kidneys to replace the ones that are damaged by disease.
That would be a total game changer for diabetic nephropathy treatment. Are these bioengineered kidneys a reality yet, or is it still just a dream?
They're still in the experimental stages mostly. Clinical trials are happening, but it'll be a while before they're widely available.
So it's early days, but there's so much potential there.
There really is. And in the meantime, we could focus on the things we can control. Managing our blood sugar, taking our medications, making healthy lifestyle choices. Every step we take towards better health makes a difference.
That's a really empowering message. Now, before we wrap up, I'm curious. What's one question you'd ask your doctor at your next appointment after learning all this about diabetic nephropathy? What's on your mind?
That's a good one. After diving deep into all this research, I think I'd ask my doctor about my own risk factors.
Yeah, it's one thing to learn about it generally, but then it's like, okay, what about me?
Exactly. Like, are there specific things I need to be extra careful about, given my health history and all that?
It's all about personalization, right? What works for one person might not be the best fit for someone else. And I think that's a theme we've seen throughout this whole deep dive, right?
Totally.
Yeah.
Like with the diet stuff and the
Yeah.
medications, it's not one size fits all.
Exactly. And even those bigger decisions like dialysis or transplant, it's about what's right for you.
It's a journey,
Yeah.
and you need a good guide for that journey.
That's why having that open communication with your doctor is so important.
Absolutely. They're your partner in all this.
And speaking of that journey, we've talked about the physical and emotional challenges of diabetic nephropathy,
Yeah.
but there's another side to it too that I think we need to acknowledge:
What's that?
the financial burden.
Oh, yeah. That's a big one. All those medications, doctor's appointments, potential procedures, it can really add up.
It's a lot, and I imagine for some folks, it can feel overwhelming on top of everything else they're dealing with.
Absolutely. It's a huge stressor for many people.
Are there resources out there, to help people manage that financial side of things?
There are organizations like the National Kidney Foundation and the American Kidney Fund. They offer financial assistance programs specifically for people with kidney disease.
Oh, that's good to know. And I imagine there might be other programs too, depending on your individual situation, right?
Yeah, definitely. Don't be afraid to ask for help. Talk to your doctor or a social worker. They can often connect you with resources or help you figure out the insurance stuff.
It's about being proactive and advocating for yourself.
Exactly.
Right.
Sometimes just knowing where to turn for help can make a world of difference.
Well said. So we've covered a lot today, haven't we? We talked about the science behind diabetic nephropathy, explored all those treatment
The
options,
medications, the lifestyle changes, the more serious interventions,
and the importance of having a good support system.
emotional support, financial support, all of it.
It's been a true deep dive. I hope everyone listening is walking away feeling a little more knowledgeable, a little more empowered to take control of their health.
That's what we hope for.
We've talked about some pretty heavy stuff today, but I want to end on a hopeful note. Even though diabetic nephropathy is a serious condition, it's not a hopeless one.
Definitely not. There's so much we can do to manage it, to live well, to thrive.
Exactly. Knowledge is power, early detection is key, and remember, you're not alone in this. There's a whole community out there to support you.
Couldn't have said it better myself.
Yeah. Well, that's a wrap for today's deep dive. Thanks for joining us, everyone. Until next time, stay curious, stay informed, and take good care of yourselves.